Hello and welcome to Unleashed. I'm your host, Will Bachman, and I'm delighted to be here today with my friend, Dr. Ron Razmi, who is a McKinsey alum. He is a member of Umbrex. He is an investor, and we're talking about his book, AI Doctor: The Rise of Artificial Intelligence in Healthcare, a guide for users, buyers, builders, and investors. Ron, welcome to the show.
Well, it's great to be with you. I love this podcast, and the fact that I finally get to be on it is a real honor.
Thank you. So, what I wanted to do today, Ron, is for listeners that have not really got into the details of the types of applications in healthcare. I wanted to focus on part two of your book, where you go through the applications of AI in healthcare area by area. And I'd like to pick a couple examples from each one of the chapters to sort of illustrate the types of ways that AI is being used. I found this fascinating. So we'll go through, chapter on diagnostics, a chapter on therapeutics, chapter on clinical decision support, population health and wellness, clinical workflows, administration operations, and then in life sciences. So, there's really a broad range of ways of being used. Let's start with diagnostics. Maybe pick one of the areas, radiology, pathology, dermatology, one of the chapters you think would illustrate how it's being used in diagnostics.
Sure. And before we get started with that, let me give a few overview remarks, which is artificial intelligence is a foundational technology. Statistical methods that can analyze data and figure out what that data means, what information means, and consequently, if you know what are the insights within finite amount of information or data, you can figure out what to do as a result of those insights. So that's a big difference between AI and a new pacemaker or a new MRI machine, is that you can take these methodologies and apply it to different areas. You can apply it to coding and documentation because you can analyze the doctor's conversation with the patient and create a note out of it. But you can also take that same foundational technology, create a different algorithm that analyzes the beating of your heart and figures out if there's an abnormal rhythm going on. That's why the applications of AI in healthcare are vast and they're deep. And we're in the early stages. So if people haven't heard about this, neither have a lot of doctors or nurses and medical centers, but everybody's talking about it. And everybody is excited but apprehensive on how this is going to impact their health, their jobs, how we can improve business models at medical centers or not. So having said that, now getting into diagnostics, any place where you have good, clean, structured data, AI could be helpful in analyzing that and figuring out what that means. So if you take a radiology file, for example, from a CAT scan or an MRI, that's a fully structured file. Everything in there is ones and zeros. That's very nicely suited for AI to analyze and find patterns in it. So you can train AI to find bleeding on a CAT scan of somebody who comes to the emergency room and is unresponsive, CAT scan of the head, or a stroke. AI could be trained, become that nicely trained idiot savant who can look at a CAT scan and pick out every instance of bleeding or tumor in it. But if it hasn't been trained on an abnormality, on a type of abnormality on that same scan, it's not going to be able to call that and identify it. But human, because of general intelligence, if a radiologist is looking at it, it can notice something terribly wrong on that scan, which changes the picture entirely. So it's important to realize what AI could do and what a human can do. A human has general intelligence. It could pick out things that it's never been trained on and see this is abnormal. But AI only does what it's trained to do. So right now, AI is doing great stuff in radiology because the data in radiology is digitized, it's structured, and so forth, as opposed to areas where the data is in narrative format, it's in paragraphs and so forth. It's not as good as at doing that.
So explain to me the workflow and how AI is being used now. So you go in, you get a CAT scan that gets sent over to a radiologist who's sitting in a dark room somewhere, I imagine. And in the old days, they would just look at that image and I imagine sort of type up their answers. Now, are there sort of AI tools that are assisting that radiologist, helping point out things that they might have missed? Like maybe give us an example for one specific application or disease type, or how is it being used in practice today, and what do you see on the future for radiology?
In certain areas, AI is starting to help the radiologists. I would say the radiologist workflow hasn't been fully transformed by AI yet, but there are budding areas of promising applications. One is a company called Viz.ai. They actually have an application that reads a CAT scan for bleeding and stroke in an acute setting. So this is a problem today because if you go into an emergency room and you get a CAT scan done, you may have arm pain or you may be completely unresponsive because something is going on in your brain. The radiologist doesn't really, they go first come, first serve. That's how their workflow is today. If you have something that's marked for stroke and the AI application could immediately review it for presence of a stroke and help the radiologist. So now you have a radiologist that's being alerted by a system that tells them, down in the bottom of your pile, there's a CAT scan that you would have gotten to 2 hours from now, but that's actually, there's a stroke patient. There's a stroke, evidence of stroke on it. So radiologists could read it immediately. It also, the Viz.ai application, when it identifies a fresh stroke, it alerts the interventional neurology team, the guys that will go in and fix that lesion. So those, you can see brain tissue, seconds, minutes, hours. It's the difference between being paralyzed from a stroke, or if they restore blood flow, you can have a full recovery. It comes down to that critical minutes and hours right after a stroke happens. So that's an application where AI is making inroads, and it's really helping radiologists and neurologists help a patient regain function.
So that would be one where, in addition to actually they're doing the analysis, but it can help with triage, because even before the radiologist gets to it, it can help them prioritize which one they do next. If there's a urgent, someone suffering from a stroke, it can highlight that, bring it to the top of the queue.
Yes.
Talk about dermatology. What are some actual AI applications that exist now that are being used, and what are some that you see on the horizon?
Sure. So Google has an application now where you can take a picture of your skin lesion, upload it to Google's platform, and it gives you a differential diagnosis of what might be going on. So that's a fairly advanced application. Obviously, the picture needs to be high quality. A lot of times the issue is when you've taken these applications into the real world, the problem is the quality of data being provided to an algorithm. So, but that's an example of getting an initial AI-based opinion on what might be going on with your skin problem. And then you can follow up with the dermatologist, but at least, separating a possibility of melanoma from a regular pimple allows you to figure out how urgent it is, who you need to go see. Could you see a community dermatologist, or do you need to go to an academic medical institution because it might be a more serious problem? So these are examples of what could be possible right now.
So before I read your book, I sort of anticipated the parts about radiology. I mean, I didn't know the details, but I assumed that AI would be being used to look at CAT scans and X-rays and so forth. And the dermatology didn't surprise me. But one that did really surprise me was the one about sound AI. Talk about the sonar piece that is going on there. That really blew my mind.
That's a One of my favorite use cases because part of the problem with collecting data using wearables and apps has been that it requires people to do stuff like wear something. Older people don't keep this stuff on. They drop them in the bathroom, they lose them, and so forth. Wearables and the elderly haven't been a good match. And with apps, manually putting data in and so forth. I think ultimately for this stuff to have long-term stickiness, you need passive data collection,
Mhm.
where it's sit in the background, it's collecting data and figures out what the data means and takes action. So this idea of monitoring people using sonar or radar or infrared by emitting that, and then when you get the signal that bounces back, AI can analyze it and figure out someone's activity. It can detect falls. It can map someone's activity to see if their gait's becoming less steady. Are they staying in bed longer? Are they going to the bathroom a lot more than they usually do, which is often the sign of disease. So this kind of technology that doesn't use cameras, so you're not watching people, you can't put cameras in the bathroom. 50% of the elderly falls happen in the bathroom. So if you're using camera to monitor them, A, they don't want to be watched with a camera, but B, you can't put it in a place where 50% of the falls happen.
Mhm.
So then using these types of technologies, which are passive, they don't use camera, it's very effective. And with the demographics and people wanting to stay home, but you constantly have to check on them, or in an assisted or independent living facility, this is a game changer, right?
Yeah, this that blew my mind. So they're using the smart speaker, your Alexa to or other kind of smart home speaker to emit this high-pitched sonar and bouncing off of you, it can actually detect your heart rate, which I found amazing. That's like
Yes,
CIA level stuff.
and respiratory rate.
Wow, that
And
is
it's
great.
not expensive technology. This stuff has been around for a long time. It's just that now we're building the AI algorithms that can analyze those signals and figure out, like when I was a resident at the Mayo Clinic, one of my attending faculties told us one time, we used to sit here in the same cafeteria 30 years ago, and the radiologist would come and say, could you send your patients to us? We're trying to learn this new thing called ultrasound. And, in the early days of ultrasound, probably they didn't know what a kidney stone looked like on ultrasound, or gallstone, or what the pancreas looked like. They were collecting the data, but they didn't know what all the data they were looking at meant. It's the same thing here. There's probably wealth of information that's sitting in passive collection of data that's coming from sonar or radar indoors, but over time, we're going to learn what all of that stuff means. And there are all kinds of a wealth of stuff sitting in there that potentially helps us keep people healthier, keep an eye on their safety and well-being. But we need to start doing this stuff to uncover all of the information hidden in the data that we're collecting.
Let's just do one more area within diagnostics. Let's talk about cardiology. You're a cardiologist. You talk about how there's some AI tools that can help read an EKG. I'd love to hear, what was your training like to learn how to read an EKG? It seems like the kind of thing that AI would get to be awesome at and eventually be, better than humans, maybe within a couple of years. But what was it like learning to read an AKG, and how is AI doing being used now?
I had to learn EKGs by experience. Somebody teaches you these waves, and then you look at a bunch of them over time. You get exposed to different abnormalities, and then at some point, and actually, when I took the cardiology boards, a big part of it, which you actually, if you don't pass, you fail the whole thing. Like it's a 2-day cardiology boards are a 2-day thing. And part of it is you need to read an X number of EKGs in a two-hour period. And you can do amazing in everything else in your boards, but if you fail the EKG part, you fail the boards. And it's not just about being accurate, but speed. You had to identify so many abnormalities and so forth. So EKG is a big part of being a cardiologist because you see a lot of things that even other physicians wouldn't notice. And historically, we've had algorithms that read an EKG, even on my time, but they weren't AI based. They were program algorithms, rules programmed, and usually everybody ignored it. It was written on top of the EKG, but nobody paid attention because it was so basic and usually inaccurate and so forth. So the promise is now with AI and much more powerful technology that can learn from decades of EKGs, millions of cases, and so forth. So I would say it's very promising, as you said. It's showing some great promise on finding abnormalities on single lead data collection. Usually EKG is 12 leads. That's a good EKG because you can see the currents between the different leads. Single lead EKG has never been that helpful because the wealth of information you gain from an EKG is from the interaction of these different 12 leads.
Mm.
And still with a single lead, it's limited amount that you can do. But what you can do with a single lead EKG that comes from a live core or a smartphone application is you can discern the rhythm. You can see if someone is in atrial fibrillation or it's a normal rhythm. That's what the single lead EKG is good at. And AI could, part of the reason also with getting sort of this field-based data where you're collecting data without someone coming into a clinic or a medical center is this idea that somebody still needs to analyze the data collected and figure out what it means. That's been the Achilles heel of a lot of these telehealth applications is there's not enough resources right now to do what people are doing anyways. Now you're putting it on people to go and read data that's coming from the wild. There's no way anybody could handle that. So having AI that can take a first pass and maybe separate normal from abnormal significantly cuts down on the downstream work that needs to be done by clinicians and the medical staff. And that could make that use case possible.
Let's turn to the chapter on therapeutics. You pick one of the subchapters within therapeutics that kind of helps illustrate how AI is being used for actual therapies.
Yeah, I mean, as you notice, the chapter on therapeutics is much thinner than the chapter on diagnostics, which is massive because diagnostics is easier to do. It's about understanding what the data means and passing on those insights. That's a lot easier to do. Therapeutics means AI actually takes action. It starts, for example, in mental health, an AI chatbot interacts with someone who's having an acute mental health episode and needs help. There are not enough mental health providers, so a chatbot could be a companion that interacts with someone who's having issues and maybe calms them down and provides some frontline assistance until they could see a mental health professional. Most of the chatbots today are not AI based. They do basic stuff and then they pass you on to a human. So AI chatbots are aspirational, but a lot more possible now with generative AI. Because one of the things that generative AI has done is improving our capabilities for natural language processing. Natural language processing has been a problem area for AI in healthcare because healthcare has a lot of medical jargon. Doctors' notes are terrible in terms of they use a lot of abbreviations. They don't write full sentences. There's a way that medical information is communicated, which is very jargon heavy. So it's been natural language processing and reading clinical notes hasn't been very good to date. It is our hope that with large language models, we can significantly improve that. And then that's going to allow for these downstream use cases, for example, for these AI chatbots to interact more efficiently and better, more effectively with healthcare consumers and guide them in their care, guide them with their mental health episodes. Um, but I don't want to use colorful language in saying that they're already there because we don't know if they're there or not. We know this is a promising area.
We'll talk about a bit about just medication adherence because that sounded like there was an area where uh and it which seems kind of a silly simple thing like just take your pill in the morning, but I mean you go to your parents and they have these pill kits, right? My parents fill
Right.
up things and even theirs is relatively simple, but still it's well this one in the morning and this one midday and this one after eating something and these two in the evening and these two if I'm feeling, so it's like a lot of pills going on. So and for someone, but then, particularly for someone who's older, maybe has starting to have some memory loss or whatever, that can get pretty confusing. And having a tool to help, remind patients when to take what. So talk about medication adherence.
Yeah, I mean, obviously, it's a huge problem area. Um, Long-term studies show even people who have had a heart attack, which sort of jolts you, provides
Yeah,
a
right.
huge jolt and scares the living daylight out of you. So you're more likely to stay compliant with your medications. At 1 year, the refill rate for statins, the cornerstone of like preventing another heart attack, is less than 20%.
Wait, less than 20%?
Yes, and that's the highest documented rate. Um, so other than areas where like you have cancer and you need to take your medication, otherwise your cancer, or you have heart failure, as soon as you fail to take your diuretic, you start getting short of breath. On these long-term stuff where you don't actually have active pain
Mm,
or active shortness of breath, the compliance rate is really low.
wow.
Yeah, so technology is part of the solution. One of the things you notice about me, since sort of I built one of the first companies in the space, and I was running it for 7 years, and it was on the front lines of population health management and care coordination, care management. I saw the human element of this stuff. So a lot of the things that you hear, oh, we developed this technology, it sends a text, it sends a reminder, this is a smart bottle, or well, if they don't take their medication, it sends a message to them, or we call to check on them to make sure they're eating healthy and stuff. I've seen the chapter two of these efforts, which is the patient getting sick of it after a couple of weeks and then no longer respond to phone calls and texts and so forth. So this is not an automatic, I developed the technology, AI or not, and now we've solved this problem. There is a real human element, people whose child might be doing drugs and they don't have any bandwidth to engage with their diabetes management. So the reason they're not motivated to do it is because all the family's resources are going into helping with their child. So nobody cares about their diabetes or management and so forth. So there is a human element to all of this, which human behavior is very difficult to control, and people have other issues. So technology is part of the solution. And technologies that are not intrusive can interact with you at the appropriate moment where you're receptive, using your past data, figuring out what that moment is and what kind of communication you can respond to. These are things that AI technology, potentially analyzing your data, can figure out about you and then interact with you at the appropriate moment. And the reason AI could be very helpful here is we don't have the bandwidth for humans to do this. Smart interaction or dumb interaction, we just don't have the bandwidth. Like if you look at care management programs by insurance companies or medical centers, they're focused on small populations because that's all they can handle in terms of budget, staffing, processes. And you think, okay, this should be scaled up. So they're managing a large population. When they start with the next population, they have to roll off the first population
Mhm.
because they don't have extra staffing and bandwidth to scale that up and manage their entire, 500,000 patients that come to their medical center every year. And what happens is when you disengage with the first population, over time, there's a tendency to drift back into their old behavior.
Mhm.
So all of this is work in progress, but technology will allow us to scale up these efforts and be part of the solution for that healthcare of the future, where it's much more proactive, much more intelligent. But important to keep in mind, technology will not get you all the way there.
Now, for some people, their mental model for AI in healthcare may be that radiology example where we talked about. But let's skip over clinical decision support, just given time, and some of those are somewhat similar to diagnostics. Let's go to clinical workflows, which might not immediately come to mind as an AI application, but talk to me about documentation assistance. I know I was recently at the hospital with my mom, and the doctor spends a bit of time sitting there typing notes into the system, which is valuable, expensive doctor time to be paying for. Talk to me about some of the AI applications that are either out there or kind of on the horizon to help kind of take off some of the burden of that documentation work that physicians and nurses do.
Yeah. I mean, I had a life-threatening accident last year on my bicycle, and they had to bring an ambulance and load me up and take me to Harlem Hospital and take care of me while I was having internal bleeding, broke 5 ribs and all kinds of, this is last September. What was interesting to me, I mean, when I go to get my annual physical when I'm seeing a doctor, I see they basically come in, log into the electronic health record, and they're typing the whole time. As a physician, as an ex-physician, I noticed that nobody's looking at me anymore. They're just typing, and that hasn't changed. It's gotten worse. But also, I noticed in a critical care setting where I was having internal bleeding and I had broken bones and stuff, the residents and the doctors taking care of me were also like coming in with carts, but instead of looking at me, they were typing up their notes.
Huh.
That tells you this is a massive problem, and it leads to doctors missing clues because they're not looking at patients. If you're typing, you might miss some of the information that somebody's telling you. This is affecting quality of care. It's not just because it's bad bedside manner or the doctor and patient are not making eye contact. It actually can affect quality of care. So it's not a minor problem. And AI, in terms of when you have a microphone on you can record a conversation, that becomes a data file. And that data file could now be analyzed by technology like AI for quality of your voice, whether you're depressed or whether your speech patterns indicate dementia or a depressed mood and so forth. That's
Yeah.
one applications, but also the meaning of what you're saying. That's what natural language processing is looking at the sequence of the words and knowing what is it that you're communicating. So for that could mean that AI could listen to a conversation, and if it's well trained, extract the key elements that need to be documented for the doctor. That means the doctor could just sit there and focus on you, speak with you, and the note gets automatically generated in the format that they like.
Yeah.
Not only that, the things that the doctor communicates to the patient, I want to do, I'm going to prescribe this medication for you. I'm going to make a referral to a specialist, or I'm going to refer you to physical therapist. The AI could perform those downstream tasks, like understand what you want to do, and the system could be designed that based on that, it could send that prescription to the pharmacy. It could create that referral for you. It can create a prior authorization letter to send to the insurance company. Anybody who looks down on something like this and says, you're boring me with documentation and making referrals, doctors are spending hours doing this now. Yes, that doesn't cure cancer and heart disease immediately, but it relieves a huge burden that's right now weighing down on our medical staff. It's preventing them from seeing more patients. It's making them cranky and tired, and therefore they're not making very good decisions. If this use case could stand up in the next few years, and help nurses who are taking care of patients in the hospital
Hmm.
based on interaction with the patient, create the notes for them so they don't have to spend so much time documenting, which is required. That relieves work for everybody and will make a huge difference in the quality of care, well-being of our medical professionals. That's a great use case. I love that use case. It's one of my favorite.
And are there applications that are currently out there, in production? Are there some that are around the corner that you have heard about? Like what and where are those at in terms of, being available?
There are companies that have been working on this for several years. There's a company, Suki, that's in the book. There's a company, Bridge, which has raised a lot of money recently and claims that they could use generative AI type applications to really improve the performance of these systems. So these systems have been around. It's just the performance hasn't been great. Now with these large language models, there's possibility that could be a huge leap up in performance. So there are applications. When I was 2 nights after you attended my book launch event in New York, we had a book launch event at MIT, and there was somebody there who was an investor in a bridge and said they've booked like $100 million this year in terms of clients, medical centers that are bringing this in, and they're attracting a lot of capital. So once again, before I get too excited, I want to see the performance in the real world and make sure doctors like it and they're like, this is good, because in the past, even though there's been incremental progress, we hadn't quite arrived at the Holy Grail yet. But I think that's coming, and the fact that there are companies working on it, they're gaining traction in the marketplace. It's a good sign, but it's not a definitive sign that this use case is here and now. I want to make sure, as you see from looking at the book is meant to go beyond the cheerleading that's happening. Health AI is going to take over the world. Here are the barriers to all of these use cases. Here are the business barriers, clinical barriers, technical barriers. This has been a technical barrier use case where the performance of these systems hasn't been up to par. Therefore, the adoption rate has been low.
Mm-hmm. Mm-hmm. Let's get into that aspect of the book. So we'll pass by chapter 10, which is, along the lines of documentation assistance. Chapter 10, administration and operations. You talk about, providers, documentation, coding, billing, and get into payers and fraud detection, administrative functions,
Right.
and skip past life science to spend a few minutes talking about part 3 of the book, where you get into, if you're an investor, how to evaluate the kind of business model of some of these products. And you really talk about how you have to think about the incentives of the buyers, right? If it's going to eliminate the job of the buyer, they might not be super inclined to get it. Or if it's going to reduce their revenue, people might not be super inclined to adopt a product. So talk to me as an investor when you think about one of these AI products or applications. How do you suggest investors think about it and evaluate them?
Yeah, imagine if you're a drug company or a medical center, hundreds of people come in every year and they're pitching you products. They're giving you solutions, digital solutions. Some of them are AI. Increasingly, they say this uses AI to do X, Y, and Z. You don't have an unlimited budget. You have to decide which one or two things you're going to be able to get. A lot of your IT budget goes towards maintaining your electronic health record, integration of new practices into your enterprise EHR, and so forth. So the innovation budget, new things that you're bringing in, is part of that. It's a small part of it. It's probably 20%, 30% of it. So you need to choose. And this has AI in it, doesn't, so does 50 other things that I've seen this year. The question really is, do I have a real massive pain point right now that this could address? Could this help me bring more patients into my doors and increase my revenues? Could this help my staff with their job performance? Right now, staff shortage is a big problem. Burnout is a big problem. So medical centers are looking for those types. Pharma companies want technologies that are improve their clinical trials, accelerate their clinical trial, make it easier to find patients for their clinical trials and getting their trials to completion. So you need to focus on use cases that when you come in and say, I solved this problem, somebody's ears perk up and they're like, okay, that is actually a problem we're dealing with today. If you
Give
come
us give us a couple examples of AI products that actually work, that do something valuable, but were developed that don't really have a great business case behind them. They're not actually going to drive revenue. They're not going to reduce costs. They're not going to make the staff all of a sudden not burn out anymore. So they've
in,
just kind of been duds in the market.
yeah, there's plenty of those. That's actually a majority of the use cases today because people got a hold of data. They developed an algorithm. FDA has really set the bar low in improving it. It says basically if you can show it works on a few hundred historic scans,
Mhm.
and you're as good as a radiologist, we approve it. But that doesn't mean it's going to work in the real world. They're not asking for real world studies. So, for example, applications that improve the reading of an echocardiogram, an ultrasound of the heart, where they quantify the ejection fraction, numbers that the doctors are interested in, the cardiologists. So basically, their value proposition is that they improve the accuracy and quantification of what the cardiologist is already doing. The reality is the reading of these echocardiograms right now is good enough. If you quantify it a little bit more, it's not going to be a game changer. And also the way the mind of a cardiologist works, they like to look at these images. Even if the AI reads it and spits out all the numbers they're interested in, their DNA is they like to look at these images and these videos. Ultrasound is a moving image to get a feel for the patient's heart and the valve and how the blood is coming in and so forth. So that's one where it's not going to make a huge difference. The cardiologists are not begging for it, and it's not really going to bring new money in or improve cost structure at a medical center. So that's a use case where, yes, there's an incremental benefit, but it's not big enough to gain any traction with the user, with the buyer, because remember, those are different. A cardiologist doesn't necessarily make the decision of buying that application. It's a committee that's a leadership at the medical center. So that's an example. And the same example with other things in radiology, where yes, we help the radiologist find tumors in the liver better. Yes, you could probably find a really small lesion that a radiologist might miss, or you might be more consistent in finding these lesions, but the incremental benefit isn't much. It's an incremental benefit. It's not a game changer. The medical center is probably more inclined to go with a good documentation solution that can help their nurses become more productive and make their doctors happier. Remember, there's also a war for talent. There are not enough doctors, there are not enough nurses. So if you say, you come to us, you spend less time typing and documenting because we have this good technology, you'll have an easier time recruiting.
Now, I understand that you are also an investor yourself, and you're working on raising a fund, or maybe have already raised it. Talk to us just for a minute about now that you've got the book out. Talk to me about some of your activities related to either consulting or investing in this space.
Yeah, I mean, advising companies and funds, it's been part of my portfolio of activities for years. And actually, I find that to be extremely helpful with everything else I do because You're staying closer to use cases. You're staying close to what's being developed out there. Oftentimes, I'm advising big companies like Novartis or Roche or whatever, what have you, and evaluating health AI technologies. And so that's not going to change. Also advising other funds, like
Mm.
there are not a lot of experts in these technologies. So when funds are considering investment, they reach out to experts. For us, for our own fund, which we launched last year, we've developed a thesis based on my research for the book, and also, more importantly, my experience of running one of the first companies in this space for 7 years. What it takes to identify a great use case, and then evaluating the barriers. You could have an amazing use case, but there are just too many barriers to adoption of that use case. The data might be in too chaotic of a form for your application to work in the real world. The infrastructure within your customer's environment may be too archaic to accommodate a modern application. So evaluating these barriers up front, from our experience being on the front lines and having encountered every nightmare scenario possible, really can inform your decision-making process in choosing potential winners. So I think to be a good investor in this particular area, digital health, health AI, having been a clinician and an ex-operator is way more valuable than having been an investor in technology or healthcare in the past. That frontline experience is critical.
So once again, the book is AI Doctor, The Rise of Artificial Intelligence in Healthcare. We will include a link to the book in the show notes. For listeners, Ron, that want to find you online and keep track of what you're doing, where else would you point them?
I would say that there's a lot of information out there. There's like a healthcare AI digest. There's Fierce Health Tech that write about healthcare IT news. They write about applications of AI. They show a lot of use cases. They have a lot of interviews with experts. So you can get a feel reading these sources about what is going on in the field, what are the trends, what are the people on the front lines are seeing with these latest applications that are getting rolled out. It's important to remain skeptical and understand that this is going to be incremental. It's not going to come into our medical centers. Pharma companies don't have the bandwidth to take every AI case that comes in their direction and implement it. It's very hard to stand up an AI use case because you need to make sure there's good connection with information system. The data flow is reliable. It happens every time. So given the work involved to stand up one of these use cases, it means given their bandwidth, they can take small bits at a time and trying to make progress with that.
Okay, fantastic. And for listeners that want to find your firm online, where would you point them?
It's Zoicap, ZOICAP.com. And I think we have some information in there on what we're looking for.
Fantastic. Ron, thank you so much for joining today. Fascinating book. Congratulations on the launch. And it was great getting into it with you.
Thank you so much. Take care.